Well, let's stay on the healthcare discussion and bring to it right now our strategist panel. Stevie O'Brien is Senior Advisor at Macmillan Vantage. Ashton Arsenault is Vice President at Crestview Strategy. And Melanie Richer is a Strategic Communications Senior Consultant at Earnscliffe Strategies. Welcome to the three of you.
Thanks, Michael.
Okay. So here we have the health proposal now going to the premiers. We're hearing from the Ontario Premier. He's sounding optimistic about it, and really he's joining what we heard yesterday from both the premiers of PEI and Newfoundland Labrador. So Stevie, I'm wondering, how are government ministers feeling now that they have some premiers on side, in particular the Premier of Ontario?
They're excited. Everyone is really supportive of the new deal. This is over $46 billion in new money for public health care, and so that it's a feeling of excitement. Are the premiers asking for more money? Of course they are. They're always going to ask for more money. What I think is really great about this plan is that it's not just blindly pouring more money into the system, which is essentially what the premiers were asking us to do, but it is it's transformative. The data piece in itself is particularly exciting, and I think that there is wide support for that one as well. We're going to be able to, for the first time, track backlogs and access to mental health care across the country. Mm-hmm. That's exciting. That's transformative. That is going to look for efficiencies in the system. So I think there's an area of excitement.
Okay, a feeling of excitement now that premiers some are at least getting on side. But Ashton, I'm kind of wondering, what does then that do to other premiers who may not be as happy with it? Because of course we heard from Heather Stephenson when the proposal, or just after the proposal came out, and she said generally they're disappointed by the dollar figure amount. So here you have the Ontario Premier expressing enthusiasm ahead of the Premier's meeting tomorrow. What does it do for the other premiers who may have doubts about this dollar figure?
Yeah, I want to touch on a couple of things. So obviously Ontario is the big dog, so if you're sitting over in PMO and you're watching this unfold, you're kind of giving yourself a little pat on the back. So, job well done. I think ultimately other provinces will fall in line. To Stevie's point, we're talking about an awful lot of money on the table, and at the end of the day, as the Premier of a province, you have a responsibility to bring that home and serve your citizens to the best of your ability. What I actually think we're seeing play out in real time is frayed provincial-federal relations, and I think it's indicative of, we're coming on 8 years now of a Prime Minister that has at times decided to poke certain provincial premiers in the eye, and unfortunately for him, in the case of certain provincial premiers that I will not name, it pays to be antagonistic towards him. So I think we're seeing that play out in real time, but ultimately at the end of the day, if I'm a betting man, I think that this is going to get done. Obviously Ontario is on side. We heard good things coming out of the premiers from Atlantic Canada as well. I think it's a matter of time. Okay,
but does it diffuse, though, the argument that we heard from Pierre Poilievre? He didn't really speak much about the healthcare deal ahead of the actual unveiling with the premiers, but afterwards he says he agrees with the premiers that it's not enough money. So does the very fact that Ontario now supports the proposal, does that deflate the argument that Pierre Poilievre is trying to make?
Well, I'm going to jump on to another thing that Stevie said. I do happen to believe that this is shoveling more money into a problem that, as Canadians, we haven't properly addressed ever in the history of this country. And the way I look at it, if you look at age demographics and the like, this is a problem that's going to get worse. And unfortunately, there are too many Canadians that are unwilling to accept certain innovations in the healthcare space. And I think that's where Pierre Poilievre is ultimately going to make his bread and butter on healthcare. I mean, he's certainly not going to run on it. I don't think it's a red meat issue for him. But we have to unlock some more innovation. And you can't tell me, we're talking about $200 billion here. You can't tell me that there's no waste in the system. You can't. You just can't.
Okay, so Melanie, let me bring you in here, though, because, it is a large amount of money. But to go back to the premiers, they were looking for $28 billion annually. This is short by some $23 billion plus annually. Mm-hmm. So what does that do to healthcare? Or maybe more succinctly, what fears do you have about healthcare with a shortfall of dollars?
Totally. I'll disagree a little bit with my colleagues. I don't think it's that much money. When you split it up over 10 years, this is not, as far as I'm concerned, and I think as far as a lot of Canadians are concerned, the transformative help that we've actually been said is coming to both protect and to strengthen healthcare. I don't see how with this on the table, you do both of those things. I am quite worried, especially as it relates to the human resources problem that we have in hospitals, especially in hospitals in Ontario, what that does. And when you look at a province like Ontario that has signaled to maybe private delivery of care, what does that mean for our nurses and our healthcare workers that are working in emergency rooms? Canadians are already waiting 13 hours in emergency rooms. So if we're not investing appropriately to reduce those wait times, I think that gets worse, and that's kind of scary.
You know, I want to pick up on something that Melanie just said here, Stevie, the idea of private healthcare delivery, because, you know, we've heard the Prime Minister, he's talking about upholding the Canada Health Act, but that act does not prohibit private providers at all. So the very fact that he is talking about the act and not talking about private provision, does that exclusion mean that the Prime Minister is okay with increased privatization in the healthcare system?
No, absolutely not. I don't think you can look at this $200 billion over 10 years for public health care and say that this is supporting the privatization of the system. The Prime Minister has been unequivocal in his support of the Act. Over the years, we've taken, I was at Health a few years ago, we take action against provinces that violate the Canada Health Act. I would say in no way is this would be supportive of a privatization.
Ashton, what do you think? Because if the dollar figures are short, again, of what the provinces want, does that not back them into a corner to be looking for what is the low-hanging fruit in order to get rid of backlogs, in order to get people care? And private providers seems to be something that more Canadians are comfortable with. You know, Ipsos just came out with that poll. 60% of Canadians are now willing to look at private healthcare delivery.
I was really pleased to see that. What we are talking about is a problem that has a price tag that continues to go up, but the service does not improve. This is effectively owning an asset that we are all collectively dumping an extreme amount of money into that isn't appreciating in value. In fact, it's getting worse. It's getting worse. If you talk to people on the street, is your healthcare better today than it was 5 years ago? I don't know a lot of people who would agree that it is. And so when we're talking about things that we need to do, the system has to change, or to those who are big-time zealots about protecting public health care, it's not going to exist because eventually we're going to run out of ways to fund it. So if we don't get innovative about it, if we don't start to tweak how we think about what health care means to us as Canadians, the system's going to fail, and that would be the real shame.
Yeah, I'm wondering from both of you, as people that work with political parties, when you hear Ashton talk about that, what comes to mind?
I just want us to be super clear that the reason that our healthcare services are maybe not what they once was is because governments keep cutting, actually, the funds that go into our healthcare system. So I actually quite disagree that we're putting more money in. We're actually not, if you're looking at it. We've seen provincial governments and we've seen federal governments cut the amount of funding that we bring into our healthcare system. And we have nurses and healthcare workers saying, help us. We cannot help the people that are coming in. That's why folks are upset. Folks are upset because they're bringing their kid in and they can't get the help that they need in a timely way that actually sees whatever illness their kid has solved in a quick manner. So I think we need to be super careful when we talk about that as it relates to the funds that actually go into our healthcare system.
You know, I will say, Stevie, I think there is a concern that given the fact that Ottawa says this is the dollar figure, it does give, some would say, the provinces a bit more leeway to introduce privatization.
I mean, this is the dollar figure. We are going to be entering, or the government's going to be entering into bilateral agreements with each of the provinces on a set of identified priority areas, family health, mental health, a few others, and the provinces will be able to negotiate with the federal government within that defined space on what is applicable to their particular region. But on the spending, I did want to add one additional thing, that this is $200 billion over 10 years for the public healthcare system, on top of other significant investments that have been made into the healthcare system by the Trudeau government into long-term care, home care, mental health, as recent as Budget 2021, and top-ups during the pandemic, COVID, healthcare transfer top-ups, and billions in vaccines, rapid tests, other testing. So the government is committed to supporting provinces, to providing resources when required, and to upholding sort of the public healthcare system.
Okay, so obviously we're going to keep following this because, again, the premiers will have their virtual meeting tomorrow. But right now, before we go, I also want to touch upon the government's Official Languages Act, Bill C-13, because we are hearing, it's not yet passed, it's still going through the committee and amendment stage, but the Trudeau government really seems quite determined to pass this bill or get this bill through, even though there is opposition within the Liberal ranks. And, I'll begin with you here, Stevie, because to speak to a lot of Anglo-Quebecers, there are a number who already feel abandoned by the provincial Liberals. They're now raising concern about Anglophone rights within Quebec with this official languages bill. Is the government worried at all of alienating Anglophone voters in the Montreal area?
I think the Prime Minister and Minister Petitpas-Taylor are bringing this bill forward because they believe it strikes the right balance. Harper was draconian in whipping his caucus. Trudeau hasn't been. You have to look at Nate Erskine-Smith, Joel Lightbound. The Liberals understand that members have to speak for their constituents, and unanimous agreement amongst 158 MPs is rarely the goal. It's their job to advocate for their ridings and for their constituents. I know Anthony Housefather very well. We've worked closely together. He is a passionate advocate for his constituents, and he's doing his job.
I'm wondering what your take on this bill is. And again, it's still working its way through Parliament, but both the Conservatives and the NDP supported the preamble that essentially acknowledges Quebec's charter in the French language. And that is protected by the notwithstanding clause. Is there a concern that even Anglophone voters don't have a party if the other opposition parties in the province support a preamble that supports the notwithstanding clause?
Welcome to Canada, where asymmetrical federalism rules the day. Obviously this is not a one-size-fits-all approach, and I think if this was popping up in other regions and areas of the country, we'd have to do some introspection here. I don't think this is going to create long-term issues. What I will say in terms of caucus discipline, they're probably looking at the same numbers that I'm looking at, and when you start to see those numbers, you start speaking out of turn. The call is coming from inside the House. They've backed down on gun legislation. They're fighting their own people on C-13. I think ultimately at the end of the day, this bill is going to get across the line. I don't think it's going to dramatically rewrite how we feel and think as Canadians. But this is a management issue, and right now it's becoming a challenge. Well,
but for Anglophone Quebecers, particularly the Montreal area, it is a linguistic language right. So what do you say to that?
I think I would state the fact of having to take a proper balance to this. I think what we're seeing right now is opposition in Montreal, but we're going to start seeing opposition in other areas of the country. I think that's why we're seeing MP Toin speak up. I come from the same region that he's from, and as a Franco-Ontarian, I know how important this is, especially outside of Quebec. So I think if the Liberals don't strike the right balance here, they're going to start alienating folks in Eastern Ontario, in Northern Ontario, and also in New Brunswick. So they need to be careful.
Well, again, something that we'll be watching as it makes its way through Parliament. But thank you for this. Stevie, Ashton, Melanie, thank you for the time.
Thank you.